Hello students, welcome back to Easy Nurse, where nursing education made easy. So today we are Easy Nurse here with your community health nursing for the GNM first year students. So I know the exam is knocking in your door and आप लोग बहुत परेशान हैं क्या स्ट्रेस ले रहा है कि क्या पढ़ना है क्या नहीं पढ़ना है. So don't worry, we are Easy Nurse here for supporting you and guide you. So let's start about today's session. So in this session mainly I am covering regarding community health nursing month and the nutrition. So I am giving you some more important questions which as like they are gradually asking in the exam. Okay, so if you follow this live session, obviously you will get a one idea how to write the exam, how you have to do the presentations of the especially long essay questions. Okay, so each and everything I am giving you tips. So let's start. First we are moving into the multiple choice questions. Okay, so first multiple choice question is here, which of the following is not a functions of nutrition in the human body. So हम लोग सब लोग जानते हैं कि न्यूट्रिशन का एक्चुअल काम क्या है, हमारा बॉडी पे वो न्यूट्रिशन क्या कम कर रहा है. मेनली दे आर वर्किंग ऑन द लाइक मसल बिल्डर एज वेल एज इमोशनल बिल्डर, देन each and every part of our body as well as the cells, everything it depends on the nutrition and the nutrients. So in this there are 4 points they given. So into this 4 point, which is not as the following the functions of the nutrition. First is providing energy, second is promotion of the growth and repair, third one is preventing dehydration, and fourth one is regulating body process. So guess your answer, and the option is answer C, preventing the dehydration. Obviously nutrition is not responsible for managing the dehydration of your body, right? So let's see, move to the next question. Bodybuilding foods are mainly rich in options of vitamins, protein, carbohydrate and fats. So obviously the answer goes to option B, protein. Next question, the recommended daily calorie intake for an average adult woman with the moderate activity is approximately 1200 calorie, 1400 kilocalorie, 1900 kilocalorie, and last one is 200 kilocalorie. So the answer goes to option C, 1900 kilocalorie. Next, which of the following methods is most commonly used for the long-term preservations of the perishable foods? So these all are the options: boiling, fermentation, freezing and frying. So the option is answer C, freezing. Next is low sodium diet is most appropriate for the patients with anemia, hypertension, diabetes and osteoporosis. So the answer is option B, hypertension. Next one is which of the following best definitions of the nutrition? See the option. First option, the process of excreting the waste product from the body. Second option, the process of providing and obtaining the food necessary for health and growth. Third one is the ability of the body to fight the disease, and fourth one is the process of digesting only carbohydrate. So obviously the answer goes to option B, the process of providing obtaining food which is necessary for great health and growth. Okay, now move to the next question. The primary goal of the community health nursing is, these all are the options: to provide the curative care in hospital, to deliver the individualized care only at home, to improve the health status of the community, and to manage the administrative task in hospital. So the answer goes to option C, for improving the health status of the community. Next, one of the fundamental principles of community health nursing is, these all are the options: dependency on doctor's prescription, equal distribution of health services, third one is avoidance of family participations, and fourth one is promotions of the hospital best care. So the answer goes to option B, equal distribution of health services. Next, the first step of the epidemiological process is collections of the data, identifications of the problem, evaluations of the program, and fourth one is implementations of the intervention. So the answer goes to option B, identifications of the problem. Next, the major objectives of conductive home visit is, these all are the options: administer the IV medications only, perform the surgical procedure, provide the holistic family centered care. Last one is to replace the hospital visit. So the answer goes to option C, to provide the holistic family centered care. So do you know what do you mean by the holistic family centered care? So holistic family centered care is nothing but when the nurses or the healthcare workers, they taking care of one family in our community sector, but the care should be based on each and every aspect of view, like psychological, physical, emotional, everything. So that time it will consider as a holistic family centered care. Okay, now come to the next question: which of the following best defines of a referral system? So these all are the option. First option, treating all the patients at the community level, sending the patients from higher to the lower facility, the transferring patient from one facility to another for the specialized care, and last one is refusing the care to patients who cannot pay. Okay, so the answer goes to option C, transferring the patients from one facility to another, especially for the specialized care. Now come to the next question: the main purpose of maintaining the health records in community health nursing is, these all are the options: increasing the paperwork. Next option, keep the patient busy. Third option, ensure the continuity and then evaluations of the care, and last option, follow the legal procedure only. So the obviously answer goes to option C, ensuring the continuity and evaluations of the care. Okay, so these are the most important multiple choice questions from the community health nursing, which is covering the nutrition and CHN part. So now come to the fill in the blanks questions. So see the first questions: nutrition is the process by which the body dash dash and dash food for growth, energy and maintenance of the life. So the answer goes to ingestion, digestion, absorption. So nutrition is the process by which the body ingest, digest and absorb the food, especially for what? Growth, energy maintenance, as well as muscle development, everything maintenance. Okay, next question: food can be classified based on their functions into three groups: dash foods and dash foods. So what are the three groups? First is bodybuilding foods, energy giving foods and then protective foods. Next question: the average daily energy requirement for an adult male with moderate activity is about to dash kilocalorie per day, whereas for an adult female is it about dash kilocalorie per day. So the answer goes to 2500 kilocalorie per day for the male, and for the female 1900 to 2100. So if they're asking only one specific answer, so the answer goes to 2100 for the female. Okay, next is the primary purpose of the food preservation is to prevent dash growth, delay dash changes and maintain the dash values. So the answer goes to preventions of the microbial growth. Next one is delay the enzymatic changes and the nutritional, maintain the nutritional value. So that is the answer, the primary purpose of food preservation. Food preservation is nothing but like after preparing the food, we are keeping as a preservation in the refrigerator, so for the further uses, right? So what we have to, why we are doing this food preservation? For preventions of the microbial growth. So if we keep that food in outside of the outside of the fridge, so what will happen? It will be rotten, like so bacteria, microbes, everything will be growing up inside of that particular prepared food. So to prevent this kind of the microbial growth as well as the enzymatic changes. So what do you mean by the enzymatic changes? So इसको कहते हैं कि जब वो food prepare होता है ना, तो उसमें क्या होता है? बहुत सारा न्यूट्रिएंट होता है, which is like most essential for our body building, right? So जब if we are keeping this kind of the food in a long time, so क्या होगा? वो जो like chemicals है, वो जो nutrients है, everything they will start to reaction. Okay, so which will be creating as a bad effective way in our body. So the person will suffer in some kind of the disease conditions. Okay, so prevent this kind of enzymatic changes, we have to keep the food in a preservations. Okay, now come to the next question. A dash diet is a plant diet modified to meet the nutritional needs for a person suffering from a particular disease, while dash nutrition focus on improving the health of population through proper dietary practice. So the answer goes to therapeutic diet. So what do you mean by the therapeutic diet? Therapeutic diet is nothing but like one person, suppose as example एक मेंबर है जो हाइपरटेंशन में रहते हैं, ठीक है, जो उसका हाइपरटेंशन है, सो वो हाइपरटेंशन पेशेंट के लिए क्या डाइट देना है, दैट इज कॉल्ड डैश डाइट, DASH, दैट इज द स्पेसिफिक डाइट, राइट। सो इसको दिस फॉर दिस कंडीशन डैश डाइट को थेराप्यूटिक डाइट कहते हैं फॉर दैट पर्टिकुलर पर्सन फॉर दैट हाइपरटेंशन केसेस, ओके। सो दैट इज द थेराप्यूटिक डाइट, मीन्स व्हेन वी आर गिविंग द पर्टिकुलर डाइट फॉर पर्टिकुलर डिजीज कंडीशन फॉर दैट पर्टिकुलर इंडिविजुअल, so that time it's called as a therapeutic diet. And next is community nutrition, which is mainly focusing the improving the all over health status of the community people who belongs into that same community area. So that is the therapeutic diet and then community nutrition. Now come to the next question. Community health nursing is a field of nursing which combines dash and dash health practice for promotions and protections of the health of population. So the answer goes to nursing and public. So community health nursing is a combined factors of the two characteristics. First is nursing practice, means nursing specialization, as well as the public health services. Now come to the next question. One of the key principles of community health nursing to provide dash care based on identified needs of the community. So the answer goes to need based care. Based on the need of community people, we have to serve the care to the community persons. Next is the three main components of the epidemiological tired dash dash and environment. So the answer goes to agent, host and environment. So agent is nothing but who is the main microorganism. Host means through which barrier or through which way this microorganism is spreading from one person to another person. So that is called host, and environment means how it's going to spread it. So that is the three factors: agent, host and then environment. Next, the health assessment. In the health assessment, the dash method involves inspection, palpation, percussion, auscultation. So obviously that answer is goes to physical examination. Next, the first step in a home visit is to establish that with the family. So the answer goes to rapport. So if you not simplifying this rapport with the family, so obviously they will not feel be comfortable with you to share their problems or their perceptions, right? So that's where rapport maintenance is one of the most important techniques for during the home visit, okay. Next is the process of directing a client to appropriate services when further diagnostic or treatment is needed. So that is called referral. So suppose one patient is admitted in one general hospital or rural hospital, but what is happened there in that hospital, they are not able to give the proper specific treatment actually what the patient is needed. So at that time, from that hospital they are sending the patient to another hospital for that particular specialized care. So that is called referral system. Next one is in the community health practices, minor elements such as fever, cold and minor injuries which is managed during dash level care at the community level. So the answer goes to primary. Now we move to the true and false, okay. So see, first question, nutrition is a science which deals only with the treatment of disease through diet. Obviously not. So the statement is false. Nutrition is a science which is mainly dealing with the body build up as well as the proper growth and development from each and every phenomena of our body system. So that is called nutrition. Next is the protective foods mainly include the fruits and vegetables that are rich in vitamins and minerals. So the answer goes to true. Next is the sedentary adult man requires less energy than a heavy manual laborer. So obviously the statement is true. Next, boiling food helps in preserving all water soluble vitamins. No, the answer is false. Boiling, it's not at all help for preserving all the water soluble vitamins, okay. Next one is the low sodium diet is often recommended for patients with the hypertension. Obviously the statement is true. Next, community health nursing, they are mainly focused on the individual care, not on the health of families or communities. The statement is false. Community health nursing focus not only individual care as well as all the families, all the communities, as well all the health of people, okay. Next is the one of the principles of community health nursing is to provide care based on the needs of population. So the statement is true. Next, epidemiology helps in the identifying causes and patterns importance of that occurrence in the community. Obviously the statement is true. Next, the home visitor conducted randomly without any planned purpose or schedule. No, the statement is false. Home visit is a scheduled as well as the pre-planned services for providing the best care, for getting the informations, for collecting the history, and do the proper physical examination for each and every individuals who all belongs under that particular family in that particular community area. So home visit is obviously the pre-planned as well as objective is also scheduled. Everything is as a ready plan. Next is maintaining the accurate record and report in the community health nursing, which is very essential for continuity of care and then program evaluations. So the statement is true. Now come to the essay questions. Okay, so first questions, write an essay on the importance of nutrition in health and disease. So in this questions I am giving the outline how you have to write. Okay, so see this questions, importance of nutrition in health and disease. So mainly they're asking about the nutrition, right? So in this type of the questions, what you have to give as an introduction, like define the nutrition, what is the nutrition, okay, and you also have to explain in the role of maintaining the health and preventions of the disease in 2 or 3 lines in introduction part, not that much lengthy. Okay, so that should be in introduction. So now which point you have to move, that is functions of the food in the body. So from where we are getting this nutrition, that is from food, right? So what is the functions of the food of our body, how it's going to help for the maintaining the body as well as preventions of the disease as well as the muscle build-up or everything. Okay, so that we have to list out how it's going to helpful in our body. And next is the classifications of the food. So mainly this food classification, there are several types based on their functions, origin as well as the chemical compositions. So functions like bodybuilding, sometimes weight management, sometimes growth and development, everything. So based on functions you have to list out. Next is the origin, means source. So like plant source, vegetable source, animal source, everything that you have to write. And chemical composition, like based on the nutrients, how much nutrients is present inside of that particular food. So based on the chemical compositions also there are the classification. Next is the nutrients and their importance. So mainly in this point you have to mention like what is the daily nutrients we actually need for our basic healthy lifestyle. Okay, and if you can able to put the normal range of that particular nutrients value, that will be very much good for your presentations of that questions. Okay, so for nutrients and you have to mention the proper value, how much is actual needed. Okay, and then you also have to mention why that particular nutrient is important for our body, how is going to help in our body to improving our healthy management, then bodybuilding and etc. Now come to the effects of the malnutrition. So deficiency as well as the excess. Okay, so see the example like a vitamin D. So due to the vitamin D deficiency, what should be the disease conditions might be get, especially the children, adult as well as everyone, that also you have to mention. And if the person is getting excessive type of the as example fat or protein, everything, so that time what will be the conditions, the people which kind of the conditions people will be felt might be. Okay, so this kind of also disease condition also you have to mention. So you have to mention one nutrients, then if they are consuming that nutrients in a very less amount, so for that what conditions they will get, and if they consume in a very excessive way, then what conditions they will get. So for each and every nutrients you have to mention. And last, you in the conclusion part you have to highlight the nutrition as a foundations of individual and public health. Next is the explain the classifications of the food with examples. Okay, so in that case what we have to write, first in an introduction you have to give a proper overview of a food, what is the food, what is the nutrition, and then you have to explain why food is classified and its significance. Okay, so why food is classified. So every food is not at all necessary for our body, like junk food, fast food, that is not necessary. So it's actually affecting our body system, right? So which food is necessary and how is going to helpful, so that you have to give it as a introduction part. Now come to the classifications of the food. So into this mainly there are so many classifications, mainly three. First is based on functions like body building, energy giving and protective. Next one is based on origin, animal and plant source. Last one is based on chemical composition like carbohydrate, protein, fats, vitamin, minerals, water, everything. Now come to the nutritional importance of each group with a food example. So suppose magnesium. So why is important in our body, and the magnesium from which source of food will get exact type of the magnesium which is actually we require for the daily life. Okay, so like this way if each and every nutrients you have to give a proper food example. Next is uses in the planning as well as a balanced diet. So why it's needed, why you have to go for the balanced diet, why how you have to plan to maintain the proper healthy diet. And at last in the conclusion part you have to emphasize the importance of the balanced mix of all the food classes. So if you go through just one classifications of the food, as example the protein, so what will happen, your body you will be getting more obese as well as you will get like some type of the worm infestations or worm disease, everything, right? So you have to balance each and every classes of the food which will be helpful to balance all the nutrients and all the growth and development at a certain time in your body. Now come to the next question. Describe the normal dietary requirements for the different age group. Different age group means from the neonatal to till the adolescent. So each and every age group of the people, they need the different food and different dietary requirements based on their age and based on their development, right? So you have to in the introduction part you have to define the dietary requirement, and also you have to recommend it the dietary allowances. What is the dietary daily allowances? Like suppose one person which is who is suffering in a diabetes mellitus, and the person is around 45 to 50. So for that every day what type of the food they will get, how much in calorie they need to intake, how much energy they need to intake, how much carbohydrate they need to intake, everything. Okay, so it should be very specified. So that is called recommended daily allowances. Now come to the next topic, that is factors affecting dietary requirements. So what are the factors, external as well as the internal, which is mainly like affecting the dietary requirements for the continuation. First is age. Okay, some people is having like while the age will be growing up, so they can't able to consume more food which is actual they need. Okay, so that is one of the thing. Next is the sex is like gradually if you see like men will be consume more food compared to the women, right? So sex is also one of the important factor. Next is the activity, like physical activity. Some people they are active physically so much active and they are doing running, doing everything, and some people they can't able to do every so much activity, physical activity in a day, as well as a physiological state, like based on the gesture, posture, everything else will be demanded. And then climate, from which background, from which climate you are belongs to. Suppose if you belongs in the very hot and summer climate, so obviously you will not able to take more food which will actually need, right? So sometimes you will focus that time on very drink mostly the cold drinks and everything, right? So some people who all belongs in a proper cold climate or the normal climate, so that people can consume how much food actually they want, right? So now come to the next topic, that is normal dietary requirements for. First is the infants. So for the infants, what are the dietary requirement is needed? Obviously calcium, protein, vitamins, minerals, everything. For the children's also same. For the children's like especially preschool as well as the schooler. Then adolescent. For the adolescent, like for the teenage adolescent as well as the late adolescent. Okay, late adolescent in the sense like near to the old age period. So for that, what are the dietary requirements it needs, as well as for the teenage people, especially for the girls at that time, which elements is needed, that is iron, right? So based on the age group we have to mention. Then adults like male and female, for both sex we have to mention. Then pregnant and then lactating mother. So for the pregnant woman the dietary allowances is different, for lactating woman dietary allowances is different, as well as how much food for the pregnant woman they need some more food which will be rich in a protein, vitamins, minerals, nutrients, everything. So now come to the elderly, like a old age people. Now come to the next topic, that is examples of the balanced diet for each group. So based on same as like a normal dietary requirements, based on that we have to provide, and at the conclusion you have to give the need of age specific nutrition planning. Okay, so that is the answer. Now come to the essay questions on the food preparation, preservation and then storage method. So food preparation is nothing but if they're asking this question, so for that what you have to write for the introduction, you have to give the importance of safe and hygienic practices as well as how they have to handle the food by maintaining the proper hygiene. So now come to the food preparation method. Like there are so many methods: boiling, steaming, roasting, frying, baking, fermentation, etc., that you have to mention. Suppose boiling means at what temperature you have to boil, steaming means how you have to steam it, roasting means at which temperature, which method you have to do it. So one line you have to give. Now come to the next topic, that is food preservation method. So as we know, there are mainly two types. First is traditional and modern. So in the traditional, like drying, salting and pickling, so that is a preservation method, and in the modern, like refrigeration, canning, freezing, vacuum packing. Now come to the next, that is food storage practice. So we have to give the household as well as the commercial storage, which will be mainly helpful for prevention of contamination as well as the spoilage of the food. Now come to the next, that is role of nurse in food hygiene and safe practices, especially the nurses who are working in the food industrial area. So for them it's a very much important role to see whether the workers who are working in that food industrial area maintaining the hygienes as well as a safe practice. And one of the most important thing, that is the food labeling. Okay, like authorized, whether it's going to authorize to the government or not, as well as the labeling, which are the nutrients present inside of that particular drink or food, whatever, and how much content is present, like fat how much gram, potassium how much gram, magnesium how much gram, everything we have to check it. Next, at the conclusion, we have to give the proper safe food preparation as well as the storage method, which is be mainly vital for prevention of the foodborne diseases like diarrhea, vomiting, etc. So now come to the next topic, next question, that is explain the therapeutic diet and community nutrition in detail. So therapeutic diet, as I said, specific diet for specific disease for specific individual, and community means all over community health people. Now come to the introduction. So in that we have to mention the what is therapeutic diet, and we have to mention what is the community nutrition. So therapeutic diet, like purpose and indication. What is the purpose for maintenance of the therapeutic diet? How is going to helpful for the patient, and indications like diabetes mellitus. So for that, what is the indications to maintain the therapeutic diet? As example, high blood sugar, low insulin resistance, as well as no insulin prepare inside of the body. So same as like you can see the gangrene, gingivitis, everything you can include. Now come to the types, like soft, liquid, bland, diabetic, high protein, low sodium, etc. And in that case, we have to also mention about the role of nurse in the dietary planning for the patients. What is the healthcare worker's role? Means the nurse's role for planning as well as for implementing that plan for that specific diet patients. Now come to the community nutrition. So in that same definition as well as the scope. What are the scopes are present for the community nutrition, that also we have to mention. Then also we have to mention about the nutritional problems in our community. What are the problems the people mainly they are facing, like communicable as well as an uncommunicable disease like malnutrition, anemia, vitamin deficiency, etc. Next come to the national nutritional program. What are the nutritional program are present in our community, that health education as well as that information also we have to provide to the community people. As example, ICDS, Integrated Child Development Services. What are the main objectives? What are the strategies? What are the beneficiaries for that program? Everything we have to give the information, so they will get that an idea and they will be one step move for that program. Now come to the midday meal. What is the why this midday meal the government is included in our community program? what is the main concept of the midday meal program? The children's, what type of the nutritions they are getting, okay, and which class, up to which class they will get in that particular midday meal program. So everything we have to give a proper idea. Next is the vitamin A prophylaxis. So what is the vitamin A, what is the importance of the vitamin A? If they are not having the proper vitamin A, like if they are present in the lack of the vitamin A in their circulation system, so what will happen? Obviously, as example, they will get a bited spot in their eyes, which will be one of the first initiative causes of the blindness. Okay, now come to the, as well as night blindness also they will get. So now come to the next topic, that is role of nurse in nutrition education as well as the outreach. So what is the nurse's role? What should be the initiative they will take for implementing that particular program as well as the nutritional educations, and how they will go to the outreach, that all the information will be spread to all over the community area. So that roles you have to write, and at the end of the conclusion you have to write about the nutrition as a key area of the nursing for the both hospital as well as the community settings. In the hospital, who all are already admitted in the ward, so for recovering of that particular patients we have to provide the proper nutrition, right? Same as like in a community settings, when we are going for the home visit as well as a family visit or family healthcare services, so that time we are seeing so many people are suffering for so many disease conditions, and they are having at least some kind of the symptoms which will be like is the initiative phase of that particular disease condition. So at that time we have to provide a proper food, proper nutrition and proper education, which will be helpful for managing as well as preventing those diseases. Okay, now come to the next question, that is discuss the role and scope of community health nursing in India. So community health nursing in India, it's a dynamic as well as very essential branch of the nursing, which is mainly focused on the delivery of preventive, promotive and curative as well as the rehabilitative healthcare services to the individual. You just remind preventive, promotive, curative as well as the rehabilitative. So these four characteristics of care should be present inside of our community health nursing practices, as well as the beneficiaries are like an individual, family and group within the community. So scope has expanded with the evolutions of public health holistic policies, rural health mission and increase the focus on primary health care. So see first role of the community health nursing. First is the health promotion and disease prevention. Okay, so into this, what is the main features? We have to educate the individual and family about the healthy lifestyle, hygiene, nutrition, physical exercise, immunization, sanitation, and also we have to conduct about the awareness program and then campaign inside of the rural and urban area to get some knowledge about that particular disease condition. Next is providing the maternal and child health services. So for this, what is the main characteristics? We have to assist in antenatal, intranatal and postnatal care for the mother. We have to monitor the child growth and development. We have to support for the breastfeeding, weaning as well as the immunization. Next is delivering the primary health care. So into this also we have to work in the sub-center, primary health center, urban health center, and also we have to provide the first contact care for the minor illness as well as the chronic information. So if they have any minor illness like any kind of the diseases, minor diseases as well as any morbidities or everything, so that time we have to take care about it. Next is the family health nursing. So into this we have to identifying and also we have to addressing the family level health problems, and we also have to promotions for the family planning, reproductive health as well as the psychological support. Next is the home visit and then community outreach. So into this we have to visit the home for assessing the needs, for providing the basic care and for educating the families, and also we have to ensure for the follow-up care and then compliance with the treatment. Next is the participations in the national health programs. So mainly for this we have to implement the government initiative like the National Health Mission, NHM, Janani Suraksha Yojana and Universal Immunization Program, etc. for the community people. Next is the surveillance as well as the health monitoring. So for that we have to detecting and reporting the outbreaks, especially the disease condition if there is any chance or already outbreak. And next is the maintaining the health records and participating in the our way, especially like while we are going for the home visit as well as the family health services. Now come to the scope of community health nursing. So what are the scope? First is urban and rural healthcare services, school health service. So into the school health service we have to go for visit for the school to school, and we also have to taking the history, how many children are suffering, any if there is any history we are suffering for any kind of disease and all, as well as also we have to give the proper hygiene and health education from the child to the adolescent. Next is occupational health nursing, geriatric as well as a palliative care, rehabilitation services. Next is the health program implementations, research and health policy input, health educations and counseling, training and supervisions of health workers, and integration with the Ayush or the traditional health practices. Ayush means Ayurveda, Yoga, Unani, Siddha and Homeopathy. So how these five factors is going to implementing the health services in our body, and how is going to help to muscle build up as well as any other factors of our body, that also you have to give a proper information as well as a modern health practice also. So now come to the conclusion. So role and the scope of community health nursing in our India is very vast as well as evolving, right? So with the growing of the health challenge and the greater focus on the preventive and then primary care, so community health nurses, they are mainly essential for transforming the community health nurses by acting as an educator, caregivers, advocates as well as the leaders within the health system. Next is the principles of community health nursing. So what are the principles? So mainly these principles in providing the ethical, effective and then people-centered care at the community level. So key principles as like equity in the healthcare. So when the nurse, they are going to serve the proper healthcare in each and every people, they have to keep it in their mind like every care should be a very equal basis. Okay, so the quality of care should not be based on any kind of the financial status or the geographical area or any other factors. Next is the prevention and health promotions, which is mainly prioritize the preventive measures. Then community participation, we have to involve the community people to participate in any other programs which will be helpful for managing their health programs as well as in improving their knowledge about the disease. Next is the intersectoral collaboration. They are mainly collaborating with other sector like education, sanitation and agriculture. Then holistic approach like addressing the physical, emotional, social and then environmental factors, accessibility and then adaptability. So in this case we have to give the services which should be easily accessible and culturally appropriate. Next is the evidence-based practice. What are the data, which data we are going to use and what are the research we are doing, so that should be very much initiative to each and everything, okay, which will be mainly helpful to guide the interventions. Next is the continuity of the care. We have to provide the ongoing care and then follow up. So at the conclusions we have to adhering these principles which will be mainly helpful to enable the community health nurse to provide the comprehensive, people-centered and then sustainable healthcare services. Next question, steps of community health nursing process. So as we know, community health nursing process, it's a very systematic as well as evidence-based nursing practices which will be mainly helpful for assessing as well as addressing the health needs in our community. So the steps are like assessment, diagnosis, planning, implementation and evaluation as like a same another nursing care plan. So for the assessment, mainly we have to collect the data and then history from the environment, sometimes for the PAC, sometimes for the CAC as well as sometimes from the individual of the family. Now come to the diagnosis. So based on the history, we have to identify about the health problems. What are the problems that people are facing in the community area as a majorly. Now come to the planning. So based on that, we have to set an objectives and we have to prepare a proper role as well as based on the objectives, and based on that we have to give the proper interventions to the community people. Next is the implementation. So we have to which plan we did, so that we have to executive in that particular phase, and after that we have to do the evaluative whether it's going to be effective for managing and prevention of that particular disease or not, that we have to give take it. Otherwise if it is not that much effective, so again we have to do another plan and we have to executive it. So the nursing process is mainly ensuring the systematic, need based and client centered care which is mainly improving the community health outcomes. Now come to the health assessment in the community setting. So mainly health assessment is a community setting which involves the evaluating the health needs, resources and problems of the individual, family and population. So components is like physical assessment, general examination, nutritional assessment which is mainly identifying the deficiencies, environmental assessment which is mainly evaluating the water, housing as well as the sanitations, then psychological assessment mainly they are assessing the mental well-being as well as the support system of the human body, family health history which is the detecting the hereditary risk like chromosomal disorder or any kind of the gene mutations disorder, everything, and risk factor identification which is like noting behaviors like smoking, alcohol use or else any kind of the substance abuse. So this comprehensive health assessment, it's a very vital for the early identifications of the health problems and planning the targeted intervention. Now come to the principles and methods of the epidemiology. So epidemiology, as we know, it's a study of the disease distribution as well as the determinants in population essential for the disease prevention and health promotion, right? So principles are like a distribution, like who, where and when the diseases occur, how it's going to be happen. Determinants means why disease occur, and then frequency means incidence as well as the prevalence, how many persons they are getting that disease at a certain time and how it's going to be prevalentive. Now come to the causations as well as the risk factor. So we have to check about the risk factor group of people, which age group of the people are under the risk factor and what are the main causative organisms as well as any other factors. So now come to the methods. There are mainly three methods: descriptive studies, analytical and then experimental studies. So in the descriptive studies we have to check the patterns of the disease, whether it's spreading from one person to another person through the nosocomial infections or through any kind of respiratory distress or any other things, or else it's going to be spread from one gene to one family to another family, or through the gene basis or through chromosome basis, that we have to check. Next is the analytical studies. Mainly we have to compare this affected as well as the unaffected persons as a symptom wise, and also we have to do the interventions as a research experimental studies. Okay, so this epidemiological method as a support effective public health family planning as well as a control of disease which through the evidence based decision. Now come to the next question, that is family health nursing care. So what do you mean by this family health nursing care? It's mainly emphasizing the maintaining and improving the health of the family as a unit. Okay, so what are the aspects? Health education, disease prevention, maternal and child health services, nutritional counseling, support for the chronic illness as well as the disability, home-based care as well as the referral service. So as a conclusion, like family-centered care, which is a holistic health care, and mainly it's going to enhance the resilience as well as reducing the health risk in the community people. Now come to the next question, that is steps of a successful home visit. So that is one of the most important questions. Okay, home visit for 2 marks, 5 marks, 10 marks. So home visit is a very essential for delivering the personalized care, which is mainly especially for those who are unable to access the health facilities. Okay, so first, what are the steps? First is planning. We have to do the plan based on the purpose and based on the materials needed. Next, approaching the family. When we are going to reaching to that particular family, so we have to build a rapport to gaining the trust and consent. Next is interviewing. So through the interview method, face to face, we have to collect the health history and then lifestyle data. Next is the observation. So after that, we have based on the data, we have to observe whether home environment, whether they're living in a hygienic environment or not. After that, interventions. So we have to provide the care of the health educations. Recording means we have to document the findings as well as the actions, and follow up we have to revisit based on the need. So this structured home visit which fosters a deep understanding of family health dynamics and ensure the continuity of the care. Next is the importance of a referral system in the community health. So referral system, it's mainly ensured that client receive the appropriate care at a right level of the healthcare system where services are not available at the primary level. Okay, so what are the importance? Timely access to the specialized care, avoiding the complications, efficient use of the resources, improve the continuity of the care, feedback mechanism from higher to the lower contents, as well as reduces the burden in the tertiary care. So mainly what is happens, suppose as a community health nurse you went for the home visit, okay, and you find some the difficulties in some people of that particular community area, and the area is totally rural area. There is no proper health facility, there is no one to provide the quality of care to those person. So at that time what should be your role? You have to refer to that particular persons from that area to PAC. If the PAC is failure to provide the proper treatment, so from the PAC is your role to refer that patient from PAC to the CAC, okay. From CAC, same, if they are not eligible to give the proper like specialized care, then they have to refer the patient to the district hospital, from district hospital to the urban hospital. So that is the chain of the referral system in the community settings. So based on the area, based on the specialized care, as a nurse it's your role to refer to that particular patients in a healthcare settings. Next, so it's an effective referral system which enhance the quality as well as the efficiency of the healthcare delivery, which is especially in rural as well as the underdeserved area. Next is the types and importance of the records and reports in the community health nursing. So mainly this accurate record and report, it's a very critical for the effective planning, monitoring and evaluations of the community health programs, right? So what are the types? Like family and then individual health record, maternal and child health record, immunization record, register like birth register, death register, eligible couple register, everything, as well as the daily diaries and monthly reports. So these all are the types. Now come to the importance. What are the importance for maintaining the record and report? It should be work as a legal documentation. Then when the person will come for the next visit, so it will helpful as a continuation of the care. Then monitoring the health trends, then evaluations of the services as well as a resource planning. Okay, so maintaining this accuracy of the record and report, it's a very fundamental responsibility for community health nurse, which is mainly help to contribute the transparent as well as a quality healthcare delivery. So next question is identification and management of the minor elements. So minor elements is very common and it's also self-limiting the conditions which will be managed effectively at the community level for reducing the burden to the health centers. Okay, so what are the like more common minor elements like fever, diarrhea, cold cough, skin infections, minor cuts and burns, eye irritation, etc. So management like a symptomatic treatment, as example paracetamol, ORS, topical ointments, and then health education about the hygiene, hydration, test, as well as the observation and follow-up for that particular disease conditions, and referral if it is there is no improvement, right? So that is the like management of the common minor elements. So this prompt identification as well as the management of the minor elements by community health nurses, which will be mainly helpful for prevention as well as the like complications and ensure the quick recovery of that particular people and that particular community area. So in these sessions I discussed almost all the important topics as well as the points or the questions which will be gradually they're asking in their exam. Other than this, you also have to study the test book, and also you have to get all the points and then specific disease conditions, and you have to look up on all the pages as well as all the chapters. Okay, so I hope you all understood my sessions. Again we'll meet in next session. Till that, keep learning and stay tuned with the Easy Nurse. Thank you.